Hi, my name is Kristen and I'm a physical therapist. From the symptoms you've described right-sided pain deep in your bottom, that sometimes you experience a deep pressure in your low back. It's worse when you stand for extended periods of time, and occasionally when you sit, you get a deep ache into your buttocks. So the diagnosis that I'm going to give you is Piriformis Syndrome. Which is, piriformis is a muscle that runs deep in your buttocks, and it runs from your hip to your lower back. And often tightness in that can impinge and cause pressure and sciatic nerve type pressure, or it can just end up as a dull, constant ache, sometimes a sharp pain into the buttocks region. You've described your symptoms to be on the right, so I'm going to show you exercises specifically to address that right-sided pain, but we're going to treat both sides of the hip so you don't get it into the left hip as well. So the first thing I'm going to have you do is, when you experience any acute pain, I always recommend ice. I recommend cold packs for 15 minutes 2 to 3 times a day, at least an hour in between those episodes. The reason why I almost always recommend ice is to control that inflammatory stage, which significantly reduces pressure off the nerve and reduces your pain level. So I'm going to have you ice 2 to 3 times a day for 15 minutes for 2 to 3 days in order to significantly reduce the inflammation. And once you get that under control, the pain seems to subside. So after you've done that, or as you've done that, you can do these exercises as well. I want you to stay below the level of severe pain. So the first thing I'm going to have you do is you're going to lie on your back with your knees bent. And the first exercise I'm going to have you do is just pulling your knees in towards your chest. And you should feel a stretch right here through your low back. The stretch, it should be comfortable. More is not necessarily better. And I'm going to have you hold it for 15 seconds. And then release. And then again, pulling your knees in so you feel a gentle stretch. Your low back should melt into the table or bed that you're performing these exercises in. Then next, after you've done that 2 to 3 times, you're going to just grab one knee at a time and hold it in. Holding it for 15 seconds, release, and then do the opposite leg. After doing that one, 3 times on each leg, holding it for 15 seconds, I'm going to have you cross your ankle over your knee, and you're going to pull that knee up towards you, and you'll feel a stretch. In this case, with the right leg crossed over the left leg, you'll feel a stretch in your right buttocks region, which will really get down and target that pain that you feel. You should go to the point where you feel a stretch, maybe pressure, but not any sharp shooting, stabbing pains. Hold it for 15 seconds and release. And then repeat on the opposite leg, crossing your leg over and drawing your knee in towards your chest. If you have difficulty reaching in through your knee, you can always just grab the back of the leg here. You can even use a strap, a belt, that can go behind the leg and pull it in if you can't reach. Some people with tighter hips may not be able to bring their knee all the way in, so you'll want to just grab and come in as far as you can, pull it in towards the point you feel a stretch, and hold it for 15 seconds. And performing it 3 times on each leg. So alternate again, and go ahead and pull it in. Then the last thing I'm going to have you do is, you can do a self-massage. You can really use anything. This is just one of the generic massage balls, anything. You can take a tennis ball, you can take the bottom of a cup, something that you can hold on to, and just massage gently into that area that you feel pain. Normal tissue does not hurt. So as you go through, you'll find that there's areas of more soreness. You want to go to where you can tolerate the pressure. More is not necessarily better because you can flare yourself up. You're just going to massage into that area as gently and easily as you can. And as you keep doing it, you'll realize you can tolerate more and more pressure into that region. And then repeating those stretches and then this massage and following it by use of a cold pack will significantly reduce your symptoms. That should address your question. If you have any further questions, please feel free to contact us. Be well.